Welcome to The Health Line, issues that shape our well-being. I'm your host, Dr. Andrea Ault-Brutus. In The Health Line, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving, complex healthcare system. Today, I'm very excited to have Dr. Corinne Kyriacou on The Health Line. Dr. Kyriacou is an associate professor and vice dean for the School of Health Sciences at Hofstra University. Prior to becoming the vice dean, Corinne was the founding director of Hofstra's Master of Public Health program and director of the Master of Science and Community Health program. Dr. Kyriacou is here today to talk about Hofstra's upcoming National Public Health Week, which is taking place at Hofstra from April 1st to April 11th and is open to the entire community. Dr. Kyriacou, welcome to The Health Line. We are very excited to have you here on the podcast.
Thanks so much for having me.
What exactly is National Public Health Week and how did it get started?
The first week in April every year, the American Public Health Association brings together communities and organizations from across the United States to observe National Public Health Week. And it's really a time to recognize the contributions of public health and to highlight issues that are important to improve the health of our communities. Essentially, it's like a nationwide campaign. The purpose is to educate the public, educate policymakers and practitioners about important health issues. And this is the 30th anniversary of the National Public Health Week. And even more exciting than that, it's the 13th year that we've been holding a National Public Health Week event series right here at Hofstra.
Public health has gained a lot of attention over the last 5 years, actually. Why do you think it's so important that we celebrate public health?
You know, public health is often invisible. When it's working well, you just don't see it. It's like people have no idea what goes into keeping our drinking water safe, our food safe, our air safe, our workplaces safe. And because of this invisibility, the general public doesn't really understand how important it is to fund this hidden public health infrastructure that really makes modern life possible. Mm-hmm. Public health has increased our lifespan. It saves lives every single day. But it's underfunded and it's misunderstood, and there's skepticism around science and government that really place human health at risk. There's a new PBS documentary that explores this exact challenge called The Invisible Shield that I would certainly recommend to your listeners. So just to get back, National Public Health Week is one way we can raise awareness about these important issues to help people understand how important public health is to us every day. And I'm sure you know Dr. C. Everett Koop, who served as the U.S. Surgeon General in the 80s, and he famously said, "Healthcare is vital to all of us some of the time, but public health is vital to us all of the time." And so that's something that, I think is not readily understood. But if public health were to go away, we would all suffer tremendously.
Yeah, and we definitely saw the importance of public health over the last 5 years, especially because of the COVID-19 pandemic.
Absolutely.
So this year's theme for National Public Health Week is It Starts Here. Can you tell us a little bit more about the significance of the theme?
I like to think of it as public health is really a team sport. You need clinicians, educators, researchers, administrators, activists, employers, engineers, policymakers. Essentially, you need everyone to work on improving the health of communities and to improve health outcomes. And every person can make a difference by practicing healthy habits, by being more informed, by advocating for change, by getting involved in health promotion programs and other community initiatives. And there's so many other ways to get involved. And that's what this year's theme is all about. Public health is everyone's business. It's not someone else's business. It's all of our business. And it takes all of us to make the places where we live, where we work, and where we play healthier.
Correct. And actually, what you just said there, it talks about the social determinants of health, and that's the backbone of what we do in public health, where we work, where we live, where we play, all impacts our health outcomes. And actually, I want to read this from the National Public Health Week website, where they state public health starts with each of us making a difference in our homes and communities. It's how the places we live, work, and play affect our well-being. It's the way we are all stronger and healthier together through the efforts of organizations like the American Public Health Association, which hosts National Public Health Week, and others that advocate for healthy communities.
Absolutely. Yeah. It's really true. And again, it gets back to that invisible nature, right? It's the things that we eat. It's how we're moving or if we're not moving. It's the spaces that we have to get outside. It's our education, it's all of these things. And yes, medical care is critical too, but it's only one piece of the puzzle.
Exactly.
And a lot of those other pieces fall into that social determinants of health, a bucket, and fall into the purview of what we do in public health.
Great. So can you tell us more about the exciting programs that are coming up at Hofstra's National Public Health Week?
We have 25 events across the beginning of April, and they include everything from film screenings to interactive health fairs, lectures. We're having yoga sessions, CPR and Narcan trainings, competitions, etc. We have a STEPS challenge, and then beginning Saturday, April 5th, we have events every day through Friday, April 11th. So there's really something for everyone. And not only are our students and our faculty and our staff and administrators invited, the community is invited in. And that's one of the most exciting things for me, that, we are hosting an event series that brings in our internal and our external communities together, to learn together, to dialogue together, to become informed together. And I'd like to highlight just a few specific events if I could, but I would encourage your listeners to check out our website at hofstra.edu/NPHW, or you can just type in National Public Health Week, and you can find out detail on all 25 events. So on Monday, April 7th at 1 p.m., in the Monroe Hall Theater, we're going to have 39 student teams compete for Best Short Film. And so the students have been working across the last few months on public service announcements, very short films about various public health related issues. It could be about safe driving. It could be about healthy eating. It could be about food insecurity. Lots of different topics, injury prevention that they're focused on. And they have done research and they've worked together to put together these short films. And the winning teams receive prizes courtesy of our National Center for Suburban Studies. And we have a judging panel with the health commissioner from Nassau County, as well as other health leaders that'll be there. The CEO of Harmony Health is on our judging panel. And then the winning films are actually shown in waiting rooms at Harmony Health and on the website of the Department of Health. So the students are not just doing an exercise. They are serving as ambassadors about public health issues. So that's a really exciting event. Again, that happens on Monday, April 7th, 1 p.m. in Monroe Hall Theater. That same day, 4:30 in the evening on Monday, April 7th, at the Greenhouse in the Student Center, we're going to hear from a Hofstra alum, Dr. Frank Amico, about his journey to becoming a cardiovascular surgeon. Frank will share not only what it was like majoring in community health, applying to medical school, going through medical school, having residencies, having his first job as an attending, and then all the way up until now doing heart transplants. But he's also going to share the personal side of that trajectory. And that's really important too, because physicians are providers, but they're also people. So we're going to have that human side of the process of becoming a physician. So that's going to be great. On Wednesday, we have the Brett Lake Mental Health Speaker Series. And this year we're focusing on suicide prevention. That's at 4:30 in the Student Center Multipurpose Room. Again, that's on Wednesday, April 9th. And then on Thursday, we have a jam-packed day. We have 2 film screenings, one about cervical cancer screenings at 10 a.m., and the second about improving Black perinatal health at 1 p.m. And both of those are in the Guthart Cultural Center Theater. So those should be really important and poignant conversations about critical issues. Later that day, on the 10th at 4:30, we're going to welcome the former mayor of Puerto Rico, Carmen Yulín Cruz, to campus, and she'll talk about health equity. on the island at our Global Health Symposium in the Student Center Multipurpose Room. And then one last one I'll give a shout out to. Later that day on April 10th at 6:30, we'll continue the discussion about health equity and an event on health equity advocacy in the Cultural Center Theater. So those are just some of the 25 events we have going on.
Amazing. And actually, do you mind sharing a little bit about the healthy aging types of programs that we have? I think we have one, the Aging Cafe. Do you want to talk a little bit about that one?
Outside of National Public Health Week, we are working towards becoming a more age-friendly university. And so there's been lots of effort to be intentional in our programming to engage our older community members, both on campus and outside of campus. And we have a bunch of exciting initiatives underway. One of them is a lifelong learning lecture series that we hold on campus on Mondays, open to the community. We partner with a retiree organization called PEER, which stands for Personal Enrichment in Retirement. And we talk about all different issues from art to music to politics to science. So that lifelong learning lecture series is great. We're also training students to become ombudsmen. We run a wellness and exercise program for people with Parkinson's. During National Public Health Week, we always focus on aging issues as well. And so on Tuesday, April 8th, in Hof USA, we're holding an aging cafe. We've held this aging cafe now for over 8 years, and attendees of all ages can come and learn healthy habits that they can start today to help them age better. So there'll be falls risk prevention and enhancing hearing, and they'll learn about, chair yoga and safe exercise and how to avoid scams and lots of other really important issues. And they're important to all people, but, it will be focused particularly on older adults. We invite everybody to come. And then later that evening on the 8th, we have an event called Empowering Our Communities, Navigating Alzheimer's and Dementia at 6:30 in the Guthart Cultural Center Theater. And this event will have speakers. We're partnering with the Long Island Alzheimer's Association, and we'll be providing critical information and resources for caregivers. And so the community is invited. Our students, our faculty, of course, are invited. So those are just two ways that we bring in our emphasis on age-friendly and healthy aging into National Public Health Week.
So National Public Health Week is just one of the many exciting initiatives that we offer here at Hofstra for our students, for our faculty members, for our administrative staff, and the broader community. And you mentioned some of the work that we're doing around healthy aging. What other upcoming initiatives would you like to share with our audience that we are hosting?
I would love to see folks come out for National Public Health Week where they can start engaging in some of this dialogue and learn more about the programming that we're doing. I would love to have people come to our lifelong learning lecture series. There are some other events that we work on, like we do poverty simulations every semester to help our students better understand what are people experiencing poverty dealing with when they're trying to keep medical appointments, when they're trying to follow through with treatment regimens. We think it's really critical for future health professionals to understand that and to also understand the importance of not only being a good clinician, but of being an advocate for your patients and for your clients. And I would say that advocacy thread can be connected, and you can see it through all of these kinds of initiatives that we work on in the School of Health Sciences. We find it really critical that across any discipline that our health profession students would be going into, advocacy is really important, a component of being a good health professional.
Okay, great. So anything else you'd like to share before we wrap up? As you know, many of us are very excited about National Public Health Week. As you mentioned before, they could go to the website to find out more information. Can you share the website information again for our listeners?
Absolutely. So www.hofstra.edu/NPHW, which stands for National Public Health Week. You can also just go onto Hofstra's website and type in National Public Health Week, and you'll come to our webpage. You'll learn about our 25 events. You can register at that point. All the events are free and open to the public. And if anyone wants to learn more about our age-friendly initiatives, you can reach out to me at the School of Health Sciences. Again, you'll find my name on the School of Health Sciences, and you'll find a general email that you could just send off and say you'd like to get involved or find out more information. We'd be happy to include you in that.
Great. Any other parting words that you'd like to share with our audience before we wrap up today's episode?
I guess I'll just say one more time that join the conversation. Come and be part of it. It's very easy to be frustrated about things happening in the healthcare system, in the public health sector, in society at large. Being part of the solution, being part of solving those problems will alleviate stress and help to really make us a healthier community. We need everybody's voice. We need everybody's participation. So I really hope that folks will come out and join the conversation.
Great. Well, thank you so much, Corinne, for coming out today on the Healthline podcast and sharing more information about National Public Health Week and all the 25 initiatives that are taking place. We definitely encourage our listeners to go on to the Hofstra's website and register for these events. And also just keep an eye out for other exciting initiatives that we have here within the School of Health Sciences. As was mentioned, we want people to be a part of the conversation. Public health affects all of us, whether you know it or not. So definitely want everybody to be more informed and more engaged. And so we are here to really help with that. So thank you so much for being a part of the podcast today. We really appreciate our listeners for listening. I'm Dr. Andrea Ault-Brutus, and I'd like to thank our studio engineer, John Mullen. Also like to thank WRHU Radio Hofstra for their help with the production of this podcast. If you'd like to learn more about the School of Health Sciences here at Hofstra University, please visit our website at hofstra.edu/health-sciences.